All right, let's do this. Let's go. Let's jump on in here. We're going to wait a couple minutes to get going. Welcome. Come on in. We got some people joining now. Wait a couple minutes to get started. All good. All right, they can hear me. We're going to wait just a few minutes to get started. So jump on in. Hello, Miss Kayla. If anybody has any questions along the way, feel free to jump on in and in the little chat. If you're on YouTube or on Facebook, just chat away and we will see your questions. No problemo. I cannot see most of your names, but I can see some of your names. It looks like I can see your name if you're on YouTube and you're logged in, but if you're on Facebook, I can't. No worries. We're going to wait a little bit and get more people in because we just went live. We got about, oh, there it is, 16 or 20, something like that. And then we'll get started. All right, we're getting there a little bit. Hopefully this thing posts to Facebook when I'm done. I don't know. See how it goes. We do have a special guest that joined us. I'm going to introduce her in a minute. We'll bring her on here, Miss Linda. She doesn't have her camera on, but she'll be able to talk and hear you and participate and answer questions. She's probably helped over 1,000 veterans, at least, I would say. And I'll ask her in just a minute, but she's going to be able to be a good resource for everybody as well. And we're going to get started. So here we go. Let's cut to this view. It makes it better. There's Miss Linda on the left. Let me get rid of this thing right there. All right. There you go. That's Miss Linda White. She's an agent here in our office. She's helped, I don't know, it's got to be at least 1,000 veterans over the years. And she's going to be able to lend, helping hand to whatever's going on here today and whatever questions that people have. If you have a question, just throw it in the comment section, whether you're on Facebook or on YouTube. More than happy to answer the questions as they go. So if you have something or a comment or a question or whatever, or a concern or whatever, just throw it in there and we'll do our thing. So
hello, everyone.
Linda, how many veterans have you helped, would you say?
At least close to 1,000 over the past 3 years.
Yeah, there you go. Yeah, I know it's over 1,000. So, all right. A little bit about my background, obviously, we do Medicare these days, but in my younger days, I did not sell Medicare. I didn't sell anything. I was in the Marine Corps. I come from a long history of Marines in my family. In fact, my daughter is an officer in the Marine Corps today. Let me give you an example. I'm the youngest of 5 boys. 4 of us joined the Marine Corps right out of high school. Only one of us was smart enough to go to college. And long story short, I eventually went to college. But it's just kind of like the family business, if you will. We all go in the Marine Corps. My uncle was in the Marine Corps in Vietnam. Almost all my cousins were in the Marine Corps. It's like probably 20 people that I know, all family, all in the Marine Corps. And it's just no other branch. We just go in the Marines for whatever reason. And it is what it is. But I enlisted right out of high school and eventually worked my way up, went to college. They paid for it the whole bit, became a major, and then I retired in 2015. And that's when I finally had to grow up and I got involved in insurance. I have no idea why I decided to do that, but I've been doing it ever since. I've been all over the world, served in combat. I do have a service disabled, I am a service disabled veteran. I do have a rating through the VA, and we're going to cover, because it's extremely important when you're talking to veterans about their rating and how that whole thing works and how it's relative to how you're serving these veterans. So we're going to cover the rating system a little bit. And again, you're not going to get anything like this from any other source because most people just simply have no idea what the ratings mean or what they don't mean and how their healthcare is affected. And we're going to go from there. So why help the veteran market? Well, bottom line is helping veterans. Obviously, most people like to help veterans, but it's good for you and your business, and it's good for veterans. Veterans get a really good deal from insurance companies, and I'm confident they get that good deal because it's very profitable for the insurance company. A lot of veterans, especially those who go to the VA, they rarely use their their Medicare plans when they because they go to the VA, and you'll see why here before long. So I'm guessing the reason why they offer up all these benefits, and if you're a Medicare agent, all the benefits. They're getting a lot of money back and dental and vision and all these other things. I think it's because it's very profitable for the insurance company. Again, I can't say that because I don't know internally, but I'm confident that's what's going on. And every year, the plans seem to just get better and better and better and better and better. Okay, as they're introducing new plans and upgrades every year. Now, we will cover what VA services have mandatory Part B here before long. Definitely going to be covered. Whoever asked that, again, I can't see your name if you're on Facebook, but I'll definitely cover what they have to get and what they don't, and who has to get it and who doesn't. But there's over 9 million veterans in the United States today that have Medicare right now. There's more that don't, but there's 9 million that actually have Medicare right now in the United States, at least Part A and Part B. Now, let's talk about veterans in general. Some veterans, not all, some veterans get their Medicare from Veterans Affairs, and we're going to cover that. We're going to cover each one of these, actually. Some veterans get their care from TRICARE. Some veterans their dependents get their care from CHAMP VA. We're going to explain what CHAMP VA is. It's kind of a thing that a lot of people really don't understand. We're going to go through that. And then a lot of veterans, believe it or not, especially under age 65, get their care from Medicaid. There's a rather strong dual market of veterans out there. I think it's estimated that 50% of all veterans that are under the age of 65 are on Medicaid in the United States today. So that's not a great stat for veterans, but it's a stat for you to use in your toolkit. So there are a lot of veterans that go to the VA that have TRICARE, that have CHAMP VA, or the dependents anyway, that have Medicaid, and they're going to be dual plans. So why sell to veterans? I think the biggest reason is that you get to help somebody. The second best reason to me to sell to veterans, frankly, is there's a SEP year round. For some carriers, not all the insurance carriers. Not all the insurance carriers necessarily abide by the various SEPs that are available throughout the SEP period, after, April 1 through the end of September. But some carriers do. If you want to know, I guess I could tell them. But long story short, some carriers do abide by those SEPs and some do not. You have to kind of know who those are. But again, I don't work for an insurance company, so I won't necessarily mention them right now. The retention rates are good. I wouldn't say they're excellent by any stretch. They're not poor. They're okay. But they're good if, just like any other customer in Medicare, if you're doing your new customer follow-up and your renewal activities and all that good stuff, you're going to retain your customers. Okay. You're not losing them because of Medicare and Medicare Advantage. If you put them on Advantage plans, for most of the veterans that do that, you'll lose them to competition. So unlike, maybe some other people, if they had a bad experience or something, we're not leaving for that. They're leaving just because they see another ad or something like that. So they're staying on the plans. That's good. Overall point about veterans, I'm not going to tell a bunch of Medicare agents that your clients need to have Medicare Part A and Part B to qualify. This is training we actually give to our agents here. So we assume that everybody knows nothing. That's a Marine thing in me. We assume that everybody is the common denominator, which means they don't know a squat and they're brand new. So bottom line, they must have Medicare Part A and Part B to qualify for a Medicare Advantage plan or, of course, a supplement. We're going to go through Medicare Veterans Affairs specifically, but there's a whole bunch of people at the VA that go to the VA only, a bunch of veterans that there is a SEP that's different for vets. I will cover that. I promise. Whoever asked that's different from others, sort of. But Veterans Affairs beneficiaries do not have Part B. Some I should say, even though vet affairs says that they should. So they'll have A and they won't have B. So the bottom line, when you're talking to every vet, the very first thing you need to do, I don't care who they are or what their name is ensure that they have Part A and Part B when talking to them. That's your first qualifier. So, hey, Mr. Smith, I just want to make sure that you qualify for this benefit first. You have Medicare Part A and Part B. Yes, I do. Okay, so you have your Medicare red, white, and blue card, and it has a date right next to Part A and Part B. Yes, I do. Okay, great. Then move forward with your presentation. Otherwise, don't waste your time, because trust me, a lot of them will say that they do anyway, and they in fact do not. Okay. Just know that you're going to have a substantial number of people that do not have Medicare Part B if you're marketing to the veteran community, but a large portion do. Again, 9 million do. Veterans are very skeptical in their nature. If you think the Medicare market right now is a very skeptical market, veterans are overly skeptical for many reasons, and I don't want to go into the psychology of that, but trust me, they are over the top skeptical, not trusting of a whole lot of things for many reasons. The bottom line is what we have found is don't try to be buddy and this and that and all the stuff that a lot of people make mistakes when they're doing their presentations. Just be a professional agent. Use the words of a professional agent. You know what those are if you've taken AHIP and all the other things in how you do your presentation. Hopefully you have all that down, and we won't get into all that today, but be a professional and talk like a professional. The biggest thing with veterans and being a professional, and I think it's probably the same for everybody to some degree, but have your ducks in a row. Bottom line, you better know what you're talking about, because they are going to come at you with about 5 different scenarios, and we're going to cover those today, of where they could fit in their category as their status of a veteran. And if you don't know what to do and what to say when you're presented with that scenario, you're not going to look like the professional that you should be. And so we're going to go through those today to make sure that you know what you're talking about. And if you're in here today, I'm telling you, very few people are going to teach you what I am teaching you here today. Why? Well, I have TRICARE. I am retired from the military. Obviously, we sold an enormous amount of Medicare policies. For those that don't know, I am an integrity partner. You don't get there with, if you don't sell a lot of stuff. And I have a VA disability. I go to the Veterans Affairs. I know exactly what it's like to go through the VA process. I know exactly what I know the whole system inside now. If I don't know something, I have a lot of friends that work for the VA. In fact, one of my best friends that I served with, he works for the secretary of the VA, and everything I want, I just pick up the phone and I call and get it done. And so I have very good access to the whole system. Very few people in Medicare have any of that, right? And so that experience has allowed me to be able to fully serve veterans, and I just know what's going on because I'm one of those people. And here it is in a nutshell. Some veterans, they absolutely love the VA. Some veterans, they absolutely hate the VA, but they're stuck with it. In my own personal case, I am in the middle. I'm a little more to the hate the VA than love the VA, but I'm in the middle. The problem with the VA, as it is in probably most government things, is that it's very much a local and regional problem. And I would argue it's probably the customer service and the healthcare that they have been given in the past from that facility. A lot of it is the onboarding process that a veteran gets when they go into the VA the first time. They have a very negative experience and they want nothing to do with it. Even if they have free healthcare, they want nothing to do with it. They'll be more than happy to either A, not get healthcare, or B, pay for it on their own if they can afford it. For those that just dislike it, they don't trust the VA or whatever. Again, there's another VA, veteran that goes to the VA. They love the VA. Okay, so you're going to get the gambit here. Either way, you can help both. Just know that that's something you're going to deal with. So bottom line is you can help both, but you're going to, understand that this is going on kind of behind the scenes. Those who hate the VA, they're going to like you more because you're going to show them options outside the VA, and we're going to get to that. So how do most veterans access their health care? And we're not going to talk about number 5 because, you've dealt with those people before if you've been a Medicare agent. But number 1, they go to the VA only. Number 2, and this is not really a veteran, but a dependent, they go to Champ VA. We're going to cover each one of these and what you have to do or don't have to do. TRICARE, which then becomes TRICARE for life, Medicaid, and one of the things about Medicaid is they could have TRICARE, they could go to the VA, and they could be going to the doctors out in town. So that's like kind of like a dual, basically. Or they just go out in town. There's veterans that don't have any benefits. They don't go to the VA. They don't have CHAMP VA. They don't have TRICARE. And they're just a regular person that went in the military for 2-3 years. They don't have any benefits whatsoever. And they just served, let's say during the 80s or whatever. And they don't have any issues or whatever. They served for 2, 3, 4 years. They got out, which is the overwhelming majority of veterans that are out there. They don't have any benefits. They think they might have a benefit, but they really don't have any benefit. And they see a regular doctor. But again, you may get leads that think they have a benefit. And you just got to go through those different scenarios, and you just find out they're like any other Medicare recipient. We're not going to cover those today because I assume that you come in here with a little bit of working knowledge, and you're able to, help, the average person on the street that you meet. But we are going to focus on, for sure, the top three: VA, CHAMP VA, and TRICARE. So let's talk about these folks right here. One of the questions was, what VA services have mandatory Part B? And we're going to cover that starting now. So the question that we'll have for veterans, and they'll ask, I kind of put it this way, is I go to the VA, do I need to have Medicare? The answer is maybe, maybe not. And I'm going to tell you where I think that threshold is here in just a quick second. But let's talk about the VA. Both the Medicare and the VA recommend that you enroll in Part A and Part B. When you go to both and you do all the research as we have, they both recommend it, okay? Why? Because having Medicare outside the VA allows the veteran to get care outside the VA. So those veterans that are very skeptical and dislike the VA, they probably ought to get Medicare regardless of what their rating is, and we're going to cover ratings in a minute. So the bottom line is it gives them a choice in their health care outside the VA system. And why is that important? Well, you see the bottom bullet point. The VA almost never gives a second opinion on a medical diagnosis. So if somebody says, so if a doctor at the VA says, hey, you have this going on with you, and you think, well, maybe I want to get a second opinion, the VA isn't going to do it. You're stuck with it. Whereas, Medicare, you can get second opinions. And so you can go, if you have Medicare, you can go to let's call it a civilian doctor outside the VA system, and you can get a second opinion. The VA, if a veteran only goes to the VA and they don't have Medicare, they're stuck with whatever the VA gives them, and that is it. And I don't know if I'm comfortable with that. It's one of the reasons why I would go and get Medicare if I were turning age 65. So that's something that you should know when you're talking to veterans, given their given situation. Now, here's the deal. The VA itself does not accept original Medicare Part A and Part B by itself. However, the VA does accept basically every insurance company. The VA wants to charge, I get free VA health coverage, and we'll talk about why here in a second, but I also have private insurance that I pay for. And, my wife does, I should say, so I just cover her sometimes. But they always want my insurance, and they will bill my insurance to some degree, just kind of like a copay or co-insurance, just like Medicare would do if you had secondary insurance, but in reverse. So they will accept private insurance, and that includes Medicare Advantage. So that becomes important depending on a person's rating. And so let's talk about the ratings within the VA system. And again, you're not going to get this from any insurance company because they have no idea how this works. The VA will ask the veteran if they have private insurance so they can bill them even if they're above a VA disability rating of 50%. Let's talk about the ratings. So write down on your paper, if you're ever going to market and talk to veterans, the 50% threshold. It's simple. Those who are above the 50% disability rating through the VA rating system, and I'm not talking about Social Security disability, I'm talking about disability rating through the VA, okay? Meaning they were injured while on active duty in some way, shape, or form, let's say in combat, and the VA has its own really weird rating system, and they come up with these ratings, and if they're rated 50% or above, 50% or above, they get free health care for life. That includes medications. I have a rating above 50%. I don't have to pay squat for anything ever again, if I don't want to, if I want to use the VA. All right. Now, a lot of people say, well, that's a great deal. But again, I told you I've had a bad experience personally with the VA. I would say marginal experiences with the VA. So I still will use civilian doctors, and I'll talk about that here in a little bit. The VA, if you're above 50%, includes healthcare, vision, hearing. So I get glasses from the VA if I want. I don't. Okay, I'll explain that in a minute. If I want hearing and all hearing aids and all that, I don't need them, or at least I refuse to wear them anyway. I get that from the VA. If I'm 50% or above and I only go to the VA, that's a major thing for you. Dental not included for 99.9% of veterans. Okay. Dental is included for a lot of veterans that are 100%, well, veterans that are rated 100% or above. So there's ratings above 100%. Bottom line, if they're 100% or above, they can get dental. The problem there is the waiting list might be like years in some cases, and they don't want to wait. So they're still looking for options for dental, for example, outside the VA system, even if they're 100. Okay. And the other benefits that may go with, like, for example, a Medicare Advantage plan, such as the Part B give back and so on. So below 50, so you could argue, and it's a very good argument, if you're above 50% and you're a veteran, to answer the question, do they need to have Part A and Part B? The answer is no. They do not need to have Part A and Part B, despite what many Medicare agents are going to say, you need to have it, it's mandatory, blah, blah, blah. They do not. I do not need to get Medicare at all if I have a rating, let's say 75% rating with the VA. I do not need to get Part A and Part B. I mean, I can tell you that the general thought process for a lot of veterans that are Vietnam era veterans, the people who are 65 and above right now, a large chunk, they won't get Part B, and they go to the VA and they talk amongst themselves and they'll say, hey, don't get Part B, don't get Part B, everything is for free. The problem with that is it's not free for everybody because people have different ratings. There's above 50% and below 50%. If it's free for 50% and above, it is not free for below 50%. So there's problems there within their own community, within the own community of veterans. But so there's that. Below 50%, how does it work within the VA? So those who are below 50%, they get rated for, let's say, an ailment. And this is probably a terrible example. Let's say I get my arm shot off, in Iraq, and I have a 20% rating, which is probably unlikely, but let's just say that's the case. Or like a finger, right? That might be a little easier. Then whenever I have anything related to that ailment that they rated me for, that gave me that percentage that's below 50%, that is covered. And any medication related to that is covered. But let's say it was my left leg that I had a problem with that isn't related to my original ailment that was rated under 50%. Of all my combined ailments, I'm rated under 50%. So you might have 20% of this, 20% of that, but I'm under 50%. My point is, those things that are not rated are not included under my VA coverage, and I will have to pay out of pocket. Well, the key word is might have to pay out of pocket for those type of things. And so a lot of veterans are paying out of pocket, and they think it's a really good deal or whatever. But here's the problem with that. If you recall, I said that about 50% of veterans in the United States under age 65 are on Medicaid, right? So when they go to the VA has a tiered system based on their income. And so if they're under 50% and their income is really low, basically they're not going to really pay a whole lot because Medicaid is essentially kind of paying for it. And I don't want to get into how the billing works, but the bottom line is it's like a lot of dual people. So they don't have a lot of out-of-pocket expenses. Well, what happens to those people when they turn 65 and they don't understand this? And you do, hopefully, if you've sold any duals or been in this business long enough, they receive Social Security income and it takes them out of the Medicaid, threshold a little bit or above it. And now they're going to have to start paying. And they do not know this. They do not understand this. So they don't want to get, Part B. They don't see them. They don't understand that they need to have it. And they won't, they'll deny it or whatever. They won't pay the bill or whatever. It's very common. The bottom line is if they're under 50%, my recommendation 100% of the time is they need to roll in Part A and they need to roll in Part B. If they're above 50%, I still recommend that they should get Part A and Part B, certainly not required. I recommend it because it gives them access to care outside the VA system. Not everybody's going to do it, but in my opinion, they should do that. Okay. And you now know why, so they can get, a second opinion, third opinion, or whatever. So again, when their Social Security kicks in, their income goes up, and they often end up losing, that low cost of free healthcare from the VA because it's an income-based system. So let's punch holes in the VA system. If you want to know what you're actually selling, this is what you're selling. Think about what I'm putting up on this particular slide right here on your screen. And let me make it a little bit bigger so you can see it. What you're selling against is what they don't offer, right? So 90%, it's actually probably higher than 90%, do not have dental coverage. And for those that do have dental coverage, it's hard to get because there's a long waiting line. Chiropractic is not included or difficult to get at best through the VA. Chiropractic included in a lot of Advantage plans. I get eyeglasses for cheap, very cheap, basically for free from the VA, right? Because everything is for free for me. When I get them, they give me 2 pairs of glasses and they break within 2 weeks. And I rarely wear those glasses anyway. I mean, that's how cheap they are. So, I may go there to get my eye exam because I don't want to pay for my, $70 eye exam out in town. I may go there to get my eye exam, but I'll get the prescription. I'll go buy my own glasses out in town. And a lot of veterans do that. And then, the glasses look like they're from like the 1950s. We affectionately will call them birth control because they're just kind of ugly. They're getting better. But, when I first started back in 2015, it was like so ridiculously ugly. If you put them on, nobody would talk to you, hence birth control, because no girls would want to talk to you, right? So they're not great, even though they can get them if they're above 50%. The VA healthcare can be extremely difficult to access. So my healthcare is free, and I want to give you why so many search for outside the VA right here, because this goes into the psychology of the veteran that goes to the VA. And I may or may not be talking about TRICARE. I may or may not be talking about, Champ VA or all these other things. When I go to the VA, I get free health care. I have to go to Richmond, Virginia. I live in Fredericksburg, Virginia. It's about 60 miles. Let's say I get free health care, right? Free everything. You would think that's a great deal. They have all these programs that they talk about where you can go out in town and all that. Not entirely true. I have a list of local healthcare, civilian local providers. I have a list of about 20 that I'm supposed to go to anytime I want, no issues, and then I can go pick up my pharmacy at CVS. That's what they tell you. I have called every one of those places, and every one of those places are closed. I can't get any. They have no idea what's going on. Okay, it's the government at the end of the day. The VA is an enormous organization. God bless them. I'm not saying they're bad people for the most part, but it's just not a great system. What I have found personally is that when I get to a doctor, it's been really good care. It's getting to the doctor that's a pain in my neck. And it is for everybody. And I've heard that from everybody. Let me give an example. If I'm sick and I have the flu, I had COVID a couple years ago. So, I was trying to get care. I couldn't get, to anywhere. I knew they weren't really going to do anything for me because what are you going to do for somebody? I just wanted to get some medication to maybe take the edge off. I don't know, some sort of flu or whatever, medication. I don't know, something. I drove down to Richmond feeling like crap. I go into the emergency room. Most of the emergency rooms, I mean, they're pretty bureaucratic, obviously, if you've been to an emergency room. But at the VA, they literally look at you and their head tilts sideways and they go, "Can I help you?" Like a 1970s operator on the phone. I mean, you are a nuisance to them. And that's how they treat you. I mean, you don't want to be treated like a nuisance when your arm is broken or something. And that's the VA system. In Richmond, Virginia, again, it's different all over the place. I have friends that go to the VA and they love their VA. They have no problems with it. The customer service is excellent or whatever. That has not been my experience. So that's why I lean towards the I don't really like it side of things. So for so for me, if I have something where I need a medication right now, or I want to get something to take away the cold, if I get a cold or what, I don't know what the issue is, if I want some sort of medication to get over the flu, I am not going to do that. I'm just going to go pay for it myself out in town. I go to the local clinic. We have Walmart down the road. There's a clinic right there. I go there and I get a medication within an hour from the pharmacy and I feel better. One of those things. I won't do it. I'll pay over the free option because the VA system sucks so bad. That's my opinion of it. Okay. Other people, you just got to deal with the bureaucracy and the BS and just deal with it, blah, 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 and get to the doctor. So it just depends on who you're talking to when you're talking to these veterans. But to say that I personally have had tremendous difficulty getting care in the VA is a drastic understatement, personally. I can't begin to tell you how I get a physical every year. They hound you if you don't get a physical. If you want to do anything outside of that annual physical, forget about it. It is difficult to get in there. They literally say, well, what do you want to talk to a doctor for? Well, because I have a problem. Well, what's your problem? Well, I broke my leg. Well, how did you break your leg? I mean, it's like you got to prove that you need to talk to somebody. And so you don't like receiving, nobody would like receiving that, of course, right? That's the VA system. And if you don't know somebody, and I know a lot of people, I just pick up the phone and I get right in, I'll go right through. If I want to, if I really need to push. Otherwise, I just go to a civilian doctor. And it's unfortunate that veterans are going through that, but that's just the God's honest truth of what's really going on. So as a result of that, veterans are looking for inexpensive ways to use civilian doctors. How can you provide that? You can help them with Medicare, Part A and Part B. So, yeah, they should sign up for veterans or for Part A and Part B if they're eligible to sign up for it at whatever age they're eligible. Let's assume it's age 65. So, it gives the ability for a person to go outside the VA system and do what I'm doing currently. So I'm not just stuck with the VA system only, so that I have the options to go out in town. So if I'm sick and I need immediate help, I can go get it if I want it. Now, if I have something simple, like if I have an actual ailment and I go to my civilian doctor and the doctor says, hey, you need this medication and you need to take it long term. I have one medication I have to take like that. It's vitamin D. All right. So I get vitamin D because I have vitamin D deficiency. And so it's like an actual prescription. Of course, I could just go buy it, but I am a notorious cheapskate. So when I go to my annual physical of the VA, I go to the doctor and I say, here, the civilian doctor said, I need this. Can you add it to my prescriptions? Now the VA just mails it to me every month and I don't have to pay for it. So that's how I use the VA. But God on my life, there's no way I'm going to go there if I actually have an emergency. Zero chance whatsoever. I would never go there. It's never happening. I'll go there for free stuff that's kind of minor that I don't need, a medication once, long term once I get it. But I'm not going to go there like an emergency. No way. Never happening. The VA is extremely bureaucratic when it wants to be, or just the opposite. If it wants to move fast, it'll move very fast. The other side of this is, my experience is my experience. I know people who love the VA. They have no problems with the VA. I have relatives who love the VA. They're in it right now. They love it. It just depends on where you live and where their experience has been. So it's all over, depending on, even in the same state, there's people in Virginia that go to other places here in Virginia. They love it. They have a great VA. So it depends on who, who is running. It's like anything. I think it depends on the people that are, behind the counter, right? That being said, I will say every time I've gotten to a doctor, it's been tremendous care. I've had no problems. The doctors are just as good as any other doctor I've ever been with. But it's the people that get from, where I'm at to the doctor that have always been in the way, at least in Richmond, Virginia. Okay. So why would somebody who only goes to Veterans Affairs get a Medicare Advantage plan? And I'm not just talking about MA only plans. I am talking about MA plans in general, whether it's an only plan with no drugs or if it included a prescription drug plan. Number one is money, right? That's what everybody wants. So a lot of these insurance companies, the name, right? They give, a lot of them will give X amount of money back per month. So if a veteran is going on Part B and it's $170 a month and they can get $100 or $150 back a month, they're going to love you, especially if they're rarely using the plan. So now they're only paying maybe $50 to $100 a month for Part B. That's how they look at it. And you're saving that money. And that allows them to go out in town. Sure, they're going to have a copay, but it at least allows them the freedom and flexibility to go out in town. And I hope you understand where I'm coming from now with all the things that I've told you about how the system sometimes can be for a great number of veterans. So if they go on Medicare, in the past, they thought, let's use today's numbers. I had to pay $170 in my pocket. No way am I going to do that. Well, if you could put $100 or $150 back in their pocket from some of these plans that are out there with the MA only plans, why not, right? Dental, again, most veterans do not get that go to the VA. They don't get dental of any kind whatsoever. They don't have a dental plan and they don't get dental through the VA. I do not get dental from the VA. So again, the threshold to get dental through the VA is 100% rating or above. I do not have a 100% rating. My rating is between 50 and 100%. So, it just depends on what your rating is. But even that being said, there are so many people, we've heard it. I'm sure Linda can attest to this a bazillion times. Yeah, I have 100% rating, but I can never get in there. It takes like a year and a half to get in there. So, yeah, here's someone.
Dental is a big concern for most veterans.
Say it again. I'm sorry, Linda.
I was just saying how dental is a big concern for most veterans. When I'm talking to them on the phone, it's the Part B give back and the dental. We talk about those two things, and bam, it's done.
Yeah, that's what they want. They want the Part B give back. They want the dental. Bluntly, I mean, like the nice way of putting it. Do you want teeth? To eat? Like they don't have any, and they're taking a medication that's taking the enamel off their teeth, and their teeth are going away, so they rot and they get their teeth extracted and they can't eat. I mean, that sucks, right? So, and the VA is not helping them because they don't have 100% rating. If they have 100% rating, it's going to take a year to get in to see the dentist. A lot of times, it kind of depends on the situation. But of course, if you're selling a Medicare Advantage plan, you should all know this, right? There's OTC benefits. A lot of plans have chiropractic benefits. The VA, very, 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 you can get it, but very, very difficult to get to a chiropractor. And then things like gym memberships. I had a vet in Richmond. This dude was paying for him like $150 a month for like the most exclusive gym in Richmond, Virginia. Very nice gym. And like this guy could not believe that he was going to get, at the time, it was like a $50 give back and $150 free gym membership to the same exact gym he's been paying for 10 years. And like, I was like, yes, sir, God of my life. That's what you're going to get. And he doesn't use it for anything other than the gym membership and the Part B give back. Like, the guy goes to the VA, and he just wants his gym membership. So for him, it was a $200 windfall of cash in his mind. That's how he looked at it. So, like the greatest thing since sliced bread. Never uses the plan, which is why the insurance company, I'm sure, loves him. He only uses it to go work out. The dude's like a bodybuilder type, great shape. So you just never know what their intentions are going to be. So, let's talk about a supplement, because I did say just, a supplement versus like an Advantage plan. There are a lot of veterans that go to the VA that want a supplement plan for the reasons that anybody should have a supplement plan: the freedom and flexibility and access to go wherever you want, whenever you want, without, restrictions like you would have in an Advantage plan. Certainly not that many, I would say. But there's a portion of them, especially the ones that make a little bit more money. You put them in a supplement plan. Now, here's a question. Do they need, and I don't have it in here because I think, do they need to have a drug plan included with their Medicare Advantage plan or their supplement plan? And the answer is maybe, because remember, if they're rated 50%, if they're rated below that 50% threshold, okay, they are not getting all their medications for free. I am getting all my medications for free. However, using the scenario that I gave you, right? A lot of people think MA only, MA only, MA only for veterans. Not always the answer. What if I want to have the ability to go out and buy a medication because of the VA system is messed up as it can be? Wouldn't it be kind of nice to be able to go out in town and just, like, because I'm sick, maybe I just want to go get like my lisinopril or whatever it was that I got issued. Like, let's just say somebody gives me, I don't know what medication to stop nausea. Maybe I don't want to wait 2 weeks to get that from the VA, depending on where I'm going for my VA coverage or healthcare. Maybe I don't want to wait 2 weeks for it. What do I mean by that? So if I get sick today where I live, I don't have a big VA area here. I have to drive to Richmond. If I don't want to drive, I go to a local VA doctor and they say, yeah, we're going to mail you that nausea medicine and it'll arrive in 2 weeks. 2 weeks? I don't want it in 2 weeks. I want it in 20 minutes. So if I have a drug plan, I can go right down to the pharmacy and pick up my nausea medication. My other option is I drive 60 miles one way or whatever it is, 70 miles one way, and I go to Richmond. And then I will be able to pick it up there because that's where the pharmacy is. I mean, that's the real scenario. And if you think that's like bad, I mean, I know dudes that have to drive 8 hours one way to go to be able to pick up their medication. Otherwise, this stuff gets mailed them in 2 weeks. So yeah, you can sell drug plans and PDs, if you will, with a supplement or MAPD. So I wouldn't always go with an MA only plan to a veteran. Okay. Like, you can really help a lot of them. If you're going to, for a person that goes only to the VA, they don't have other coverage, right? Like TRICARE or whatever. Are all your doctors at the VA? Once they find out about the benefits that are available in the plan, they're going to start lying. It's a nice way to put it. Would you agree with that, Linda?
Yeah, that does happen.
Yeah, I mean, we had a guy literally right in front of us. I actually kind of know the guy personally, right, for 15 years. This dude swore up and down that he didn't get any medications out in town from anybody anywhere. Sure enough, oh yeah, after we like signed the deal, the whole bit for an MA only plan, he got insulin out in town. So we had to kind of redo everything and put him with an MAPD. So do you see any doctors, nurses, hospitals, or clinic outside the VA system? You kind of have to ask these questions negatively and positively, like over and over and over, and get it from them, because they will just say, they'll lie to you thinking that it has no impact on them. And it does. So you just have to ask it in so many different ways. And this is how we typically ask. Are all your doctors at the VA? Yes. Do you see any doctors or clinics or doctors, nurses, hospital clinics outside the VA? No, I do not. And that's what you're looking for. Oh, so you get all your medications from the VA, correct? Yes, I do. So you don't have any other doctors outside the VA system, correct? No, I do. Oh, I have that one doctor. Yeah, that's what I thought. And that's going to change what you're going to do and how you're going to offer, the products for them. Argument against those who get their health care from Veterans Affairs only. I'm not talking about TRICARE. I'm not talking about Champ VA or anything else. Okay. There are almost none. In fact, I don't know of any. Okay. You can put them in these various products. They're a very good market for you. They're a very good market for the veteran. They're a very good market for the insurance company. Okay. I can't think of a scenario for those specific type of veterans. Again, I'm not talking about veterans who go to the VA who have TRICARE. I'm talking about those who only have Veterans Affairs disability ratings, regardless of what the rating is. I haven't heard an argument against it yet. There's probably something out there, but I haven't heard one yet. And we've helped about 7,000 veterans over the last so many years. If they have a doctor, but here's a key point. If they have a doctor or a local civilian clinic that they go to, then ensure the doctor or that civilian clinic is part of the Medicare Advantage network, whether it's an MA only plan or, Medicare Advantage prescription drug plan. Now, they'll say, yeah, I go to a clinic out in town, and they don't realize that that is a VA clinic. I have a clinic that I go to out in town. I assure you it is a VA clinic. A typical civilian cannot go there unless they have a VA benefit. So that is not the same, because they're never going to come up in any carrier's network. So you'll be searching all day until you're blue in the face to find this doctor, and you're going to be stressed out like, I can't help this person and blah, blah, blah. There was never a network to begin with, because they're still part of the VA, and they just don't realize that it's a VA clinic. So you kind of have to do your homework as you're doing some of that, and you're just going to learn in your local communities, as you do that. So moving on. If you have any questions, again, throw them in the chat. Linda, do you have any comments you want to add to that portion of it, this portion of it?
No, you were very thorough. Very good. Very excellent.
All righty, moving along. Champ VA. What is Champ VA? A lot of people don't understand what it is. Champ VA is healthcare insurance, essentially for dependents of veterans that are 100%. Remember, I said there's different ratings. 100% rated permanently and totally disabled, or somebody who is dead, right? Like they died in combat, and then my kids would have Champ VA, or possibly other things. But you can get Champ VA, and they're that's what it's for. It's for dependents. So a 15-year-old can have Champ VA, or a 25-year-old can have Champ VA, or a 50-year-old can have Champ VA. Okay, because maybe their father or something, or their mother had was 100% permanently and totally disabled, or they passed away or something, right? So to be eligible for Champ VA, the beneficiary cannot be enrolled in TRICARE. They cannot have both. Okay. What is Champ VA? Well, it's similar to a high deductible Plan G in many ways. It has a $3,000 currently MOOP, and that it pays for most things, but it does not have a network. That being said, providers can opt in and opt out. It's kind of weird. It has a small annual deductible and some co-insurance until you reach that MOOP. And I don't know why I left the 2021 thing on there or whatever. But at the end of the day, when it's paired up with Medicare, most things are basically no cost to the beneficiary that has Champ VA. What's nice about Champ VA, if they have Medicare and Champ VA, is there are some things, believe it or not covered by Medicare that are covered by Champ VA. And so they'll be able to get those things covered through Champ VA, and they will have out-of-pocket expenses up to their MOOP within the Champ VA system. So it's kind of a really nice thing to have. The bottom line, think of Champ VA as kind of like a Plan G, like a high deductible G to some degree, in a way. It's kind of weird. But they also get their medications and their drugs at a very low cost to no cost through the Champ VA system. It's a pretty sweet deal if they have that. Take a picture of this if you haven't already, or write this down, because if you get somebody with Champ VA, they need to do what it's showing right here, or they will lose Champ VA. The bottom line is, somebody asked earlier, are they required to have Medicare Part A and Part B if they have Champ VA? Yes, you have to have Medicare Part A and Part B in order to get Champ VA. If you do not, you lose Champ VA benefits, and you do not want to lose your Champ VA. So Champ VA requires you to enroll Medicare Part A and Part B no later than your 65th birthday, I should say, in order to keep it. And then you must submit this form, VA Form 10-7959C, within a 90-day window before, big bold in red, your 65th birthday, meaning you better get it to them before you turn 65. You're also required, if you're a Champ VA beneficiary, to turn in your Medicare ID card once you receive your ID card. And you'll see at the bottom, don't wait to get your Medicare ID card and that form to submit them all at once. Get that form filled out 90 days before and get it submitted, because as many of you know, you may not get your card until a few weeks before your 65th birthday from Medicare, and sometimes you don't get it until after. Maybe they screwed up enrolling or whatever. The bottom line is, get that form in. That form is vital to them keeping Champ VA, and they do not want to lose it. Now, what if they're late getting that form in? Technically, Champ VA does not have to, they can rescind the benefit, and they have. Most of the time they don't, but I have seen some people where they just won't give it back to them for whatever reason. Maybe they were jerks to them on the phone or something. I don't know. Don't risk it with your clients. Make sure they get this form in. It's not that complicated. They send it in. Yes. So if you're 60, whatever, 50, of course, you don't get Part A and Part B. Just like any other normal recipient going into Medicare, when you're going at age 65, you need to enroll in Part A and Part B. If you do not, you lose Champ VA. And you can get Champ VA at any age below that. That is correct. But in order to keep Champ VA, you need to get age A and B, and you need to submit that VA form 10-7959C, all right, before your birthday. Then when you get your Medicare ID card with your Part A, Part B AD on it, and the whole red, white, and blue card, you have them copy that and send that in as well, or they will lose their Champ VA. They're a lot more lax on the card because they know that Medicare waits a while to get them that card. They are not lax on that form, the 7959C. So get that in as soon as you can. So if you're talking to somebody with Champ VA and they're talking to you about Medicare, the very first question you ask, this is what I mean by using the words of professional. Say, I just have a quick question before we continue, sir. Did you get your VA form 10-9 or 10-7959 Charlie in? And if they say, what is that? You now sound like a professional, because you're going to explain what it's for. And you say, well, you have 90-day window to get it in before your 65th birthday. By the way, you also need to enroll in Medicare Part A and Part B. I mean, these are the kind of things that set you up over and above every other agent and the other 10,000 agents that are trying to get their business. Talk to 15, 20 agents, but when they talk to us, that's their last conversation ever when they're talking about Medicare, because we know what we're doing. And now you're going to know what you're doing because you just took a picture of the slide. Merry Christmas. This kind of sucks for them. And this is another thing of talking like a professional. Once a beneficiary has Medicare Part A and Part B, then Medicare becomes their primary insurance company and Champ VA becomes their secondary. Okay, that part doesn't suck. The part that sucks is the next bullet point. They're no longer able to use the VA facility. So that's a problem. And now you have yet another job to do as a Medicare agent. And I want to explain that. So most, certainly not all, but most Champ VA beneficiaries, they actually use the VA growing up. They have Champ VA and they're allowed to use the Champ VA or the VA system from whatever age up until they go on Medicare. They actually go to the VA. A large number of Champ VA recipients do. The minute they go on Medicare, they're not allowed to go to Champ VA or to the VA system anymore. So that doctor they know and love that they finally worked through and got, the VA system and they understand it now, they can't go to that doctor anymore. They're done. Why? Because the VA doesn't take original Medicare. Okay. And that's just the system. Like it or not, doesn't matter. So now you're going to find them a nice doctor out in town. You're going to set up with a new dentist, whatever, all these things. That's part of your job now as a Medicare agent. Okay. They're going to love you for this. Trust me on that. We never have a problem with Champ VA people. They love us to death because we're making sure that they don't lose their benefit, and we're making sure that they get to see world-class doctors out in town, outside the VA system. They might hate you a little bit if you say you're not going to be able to go to the VA doctors anymore or not believe you or whatever. But, make sure you say, don't shoot the messenger. This is going to happen, blah, 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 blah. But again, you're going to stand out like a real professional when you're telling these people, this is the reality of your new reality. You're going to lose your doctor at the VA. You got to submit all these forms, yada, yada, yada. And I'm going to help you do all that and make them feel good about it. And they are going to be a customer for you or yours for the rest of their life, hopefully, and yours if you live a long time. So let's punch holes in the Champ VA system, in the health coverage system. Dental, vision, hearing not included. So let's say they don't buy an MA only or a Medicare Advantage or something from you. Sell them a dental, vision, and hearing plan. Chiropractic not included. If I have Medicare and Champ VA, they cannot go to a medical facility, right? So many will ask, who to see? Like literally, they have no doctor. They have no idea where to go. And you're going to help guide them. Say, we have a lot of customers with Dr. Smith over here. You're going to love them, blah, 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 blah. So you can really, steer people in the right directions as a professional that offers Medicare to people. It does not include mental health services. A lot of Advantage plans do include things like dental, vision, hearing, chiropractic, mental health services. These are important benefits where you can help, these clients with. And, it's kind of nice to be able to do that. I mean, they're really thankful when you do. So why, if it's truly a great product like a Plan F with a drug plan, by the way, don't get them an MAPD, don't get them a PDP. This is an MA only product, okay? They don't need a supplement. This is an MA only product. Sounds eerily similar to TRICARE, all right? And unlike TRICARE, we've never had a problem with anybody on Champ VA, knock on wood. Have we ever had a problem, Linda, with anybody at Champ VA get an MA only plan that you remember?
No, not at all.
Never. I've never had one complaint. And I know you're saying, yeah, but they have basically kind of like a free Plan F with a drug plan. Why would you do it? Blah, blah, blah. Bottom line, we've never had a problem with it. And we sold thousands of these, okay? Thousands, and we still have them in the books. Why? Part B, give back, right? I mean, that's an obvious one. It's money back in their pocket. They're going to get dental. They're going to get vision, probably, the benefits of a typical Advantage plan, hearing, over-the-counter, chiropractic, mental health care, a gym membership. I mean, that's what they're looking for. And then they're looking for your expertise to get them to doctors. They're used to co-pays. They're used to networks because that's what Champ VA is when they're under age 65 anyway. When they're over 65 and they're on Medicare and they have Champ VA, there are limitations to the network, even though it's kind of like a supplement. It's kind of weird. It's this weird, unique thing. So not everybody takes it. Unlike TRICARE. So it does have its limitations. It's a little strange, but it's a very good plan. But when it's paired up with an MA only, it works well. I don't have it on here, but if they have a copay or something out of pocket, and you go look and you do the research with Champ VA, they're actually a little bit better about it than TRICARE is. Champ VA is very friendly towards, let's say you have some sort of out-of-pocket expense when you go to the doctor because you're on an MA only plan. You have XYZ, insurance company if you're MA only carrier, and there's an out-of-pocket expense. They simply would submit that. If the doctor didn't do the billing to Champ VA, and most of the time they will, but if they don't, then they would submit a claim to Champ VA after they paid it themselves. They'd submit the claim. Champ VA pays it no problem. Sometimes TRICARE is a pain in the butt. Champ VA is great, and they actually tell you exactly how to do it. You go right to their website; it's perfect. Some of them will have insurance outside the Champ VA system, so you got to have to do the same thing you did with veterans that go to the VA system. You have all your medications through the VA, through Champ VA, any doctors, blah 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 blah. I don't know why I kept saying medications, but I know why. Because you want to make sure that they don't have some sort of drug plan or drugs that they're getting outside of the Champ VA system, because they'll get most of their drugs ordered through the Champ VA that are getting through the mail. Then they'll have this one random medication they're picking at a pharmacy, and then you'll find out that they have some sort of healthcare plan or whatever. Meaning at that point, maybe they need some sort of drug plan, or maybe you need to shift that medication to Champ VA or whatever. So the bottom line, be careful on that. That can trip you up a little bit, but that's pretty much rare because most of these people understand the Champ VA system. They typically grew up with it, and it's not like they picked it up when they're 50, right? They usually get it at a very young age, and so they know how it works. Again, get all the names of the doctors. that they have, if they have them outside the VA system, and make sure they're in the Medicare Advantage network for the carrier. If they don't have doctors outside, then simply find them, a good doctor. Argument against MA only plans for a CHAMP VA. I'd say it's the same argument that you would have from a supplement to an Advantage plan. You're going to have carrier network limitations, things like denials and approvals, come with Medicare Advantage plans, right? So, that's how you have to determine what you have to do for your business. We're not getting into a big debate of ethics and all that kind of stuff right now, but these are just facts. And so these are things that you need to think about. We have not had a problem with this at all, ever, with Champ VA, knock on wood. And we have thousands of people in Champ VA that have this. They have it. We just never had an issue with it. TRICARE, different story. And we're going to talk about that next. But do understand you're taking them off what is similar to, not exactly like a Plan F or a typical supplement, with a drug plan. And you're replacing it, at least the original care, with an Advantage plan and the limitations that go with it. So, there is a comment on here. Someone says, I don't understand why someone that can go almost anywhere for their care should go on a network plan. Quality of care is the issue. I could argue, why would somebody not get a Plan G then every single time and go on a Medicare Advantage plan? It's the same discussion, right? We're not going to have that debate of ethics here today. You can do what you want to do for your business. I'm going to do what I'm going to do for my business, which at the end of the day is what the client wants to do. It's my job to simply explain to the client what the facts are and let them to decide. But we give them the truth, the whole truth, and nothing but the truth, so help me God. They make their own decisions. We don't steer people one way or another, ever. They do have costs within Champ VA, within their deductible. Yes, it's its own system within Champ VA. It's not what you like a typical Plan G. Somebody asked, Champ VA people have paid a Part B deductible. Sorta. They have their own deductibles. It's not like G. It's kind of its weird system. But yeah, they do have some co-pays and out-of-pocket expenses. But generally speaking, it's a sweet deal. I'll tell you that. Like you would want Champ VA if you had it over basically every other plan that Medicare offers. It's very, very similar to TRICARE. So again, if they get a bill, have them submit it to Champ VA, like co-pays. They will cover it. They pay it very quickly at Champ VA. They're very good about it. I'm not sure where I was going with the bottom 2 points, so I'm going to move on from that. The bottom line, it's their choice. It's your job. And this is what again, you're getting the presentation that we give it to our agents in our office and independent agents around the country. This is literally, I'm not holding back anything. You're getting the whole bit. The way I consider it, our job is to educate people on the entire system. It's their job to make the decision and give a clear yes or clear no. And we don't care what they do, one way or another. We give them the facts and they make the decision. So you can debate what you want to debate for your business, and that's fine. But I'll answer that reassessment question later. So the question is, at what point, I guess I'll just answer right now, what point can they have their VA rating assessed for those who go to the VA? Mia asked that. Once you're in the VA system, I believe it's for 10 years, they don't get it reassessed. If it's less than 10 years, they can get it reassessed. And many veterans are really in fear of that because there's money behind the scenes and the whole bit. So many will choose the MA only option over a Champ VA for the benefits. It's very, very, very common. It's very rare that somebody with Champ VA says no when we present them with an MA only option, unless a doctor that they like going to is not a network. I mean, that's just how it is for us. TRICARE, totally different. What is TRICARE? A lot of misconceptions out there. I as soon as I posted this, I had a guy said, I'd never put somebody in TRICARE on an MA only, blah, blah, blah. Listen, not all veterans have TRICARE. The overwhelming majority of veterans in the country do not have TRICARE. It's not even remotely close. Okay. What is TRICARE anyway? And what is TRICARE for life? I have TRICARE. TRICARE is for retired military. Either they served a full term to receive a retirement benefit, which is what I did, or they're medically retired. For example, they served a couple of years or whatever it may have been, and maybe they got wounded in combat or whatever, and then they were medically retired. I have lots of friends that were medically retired that I served in combat with. I was not one of those. I served over 20 years, and so I have TRICARE for that reason. Most people do not do that, nor do they have a medical retirement. So the overwhelming majority of people that are veterans do not have TRICARE. So get that out of your brain if you're one of those people. The overwhelming majority do not have TRICARE. However, if you get a TRICARE beneficiary, here's some knowledge that you need to arm yourself with so that you can arm your TRICARE beneficiary. They must enroll into Part A and Part B at age 65 to keep their TRICARE. They have to submit all of this as proof to DEERS, which is an internal administrative process for the military. Trust me, if they have TRICARE, they know what DEERS is. You may not know what it is, but if you say the word DEERS, they're going to think you're a professional. Okay. They know what DEERS is. Anybody who has TRICARE, they know what DEERS is. It's an internal administrative system. Just Google it if you really want to know what it is. So again, that question earlier, I'll put it this way. Does somebody who has TRICARE, do they need to enroll in Part A and B? Yes. I don't care if they have any other kind of coverage. Like we get a lot of people locally that have federal employee health benefit, and they don't necessarily have to enroll in TRICARE, in Part A and Part B at 65. If they have TRICARE, we tell them they better or they're going to lose TRICARE, okay? Medicare becomes their primary. TRICARE becomes the supplement at that point. However, for those people who are under age 65 and on TRICARE, that would be me, they won't understand what you mean by like a supplement and the access and the networks and all that kind of stuff, because TRICARE for people under age 65 has a network, and we have the things that go with having a network, such as, I can't go see every doctor and denials and all those things, and, referrals and blah, blah, blah. So a lot of Medicare agents don't even, understand that. And neither the insurance companies, because they have no idea what it is. So when you have TRICARE and you're under age 65, you cannot go to every doctor. In fact, it's kind of limiting in some markets. Where I live, it's extremely wide because I live where the bazillion retirees are at military retirees live. But if you're in the middle of somewhere I don't know, Oklahoma, there's probably not a lot of military retirees there, right? So very limited networks at times for people under age 65 and on TRICARE. So when they go on TRICARE, that network is just like any other supplement, like a Plan F or a Plan G, very wide, as you all know, hopefully. TRICARE medications, I don't know if they're for free per se through the Medicare system. That really should say low cost to free. Some would have a cost, but they're a sweet deal, better than any deal on any drug plan in Medicare by NAR, without question. When they're on TRICARE, TRICARE is a great deal without question, especially when they go on Medicare. TRICARE beneficiaries do have the options to get their medications at a copay at your typical pharmacy, right? Which is also a good deal, because then you can just go pick them up, as opposed to, getting them in the mail if you want to, which is a lot of people with TRICARE, they'll do both. In my opinion, TRICARE is the single best, compared with Medicare, is the single best healthcare plan in the United States without question. I mean, that's just, I can tell you it's a pretty sweet deal. Why? I think the way to explain it to at least a bunch of Medicare agents, it's like Plan F. I mean, they basically can go anywhere, anytime they want, like every supplement, without hardly any expense. And it includes a prescription drug plan with almost no cost to the beneficiary. I mean, that's a sweet deal, right? They've earned it. I mean, if they got wounded in Iraq or wherever they were, Vietnam, and they have TRICARE and all that, they were, retired. I mean, they've earned it. So, they should get it. But at the end of the day, it is a very, very, very good deal. It is better than any Medicare plan that's available without question. Okay. So, there's that. So let me punch holes in the system though. All right. We have people that don't love TRICARE, and that kind of goes back to this slide here in the middle, where it says many of you use TRICARE without Medicare will not understand this. They don't understand when they go on TRICARE. Like, there's lots of people with TRICARE that work after they retire from the military, and they don't use the TRICARE because they don't have much of a network. So they really don't think TRICARE is very good. When they go on Medicare, it is. And that's what I mean by you're going to have to explain these things as a professional, because they don't know what it really means to have a supplement, right? When you have Medicare, especially a supplement which really just has no cost to them. But these are the holes in the system. It doesn't include dental, vision, and hearing. So again, if you don't sign them up for something like an Advantage plan, and we're not going to debate it, but we'll talk about if you should or shouldn't. But you can sell them a dental, vision, and hearing plan. By the way, we often times sell dental, vision, hearing plans here, where our commissions are more than selling a Medicare Advantage plan. Hint, hint. Okay. So, there's opportunities out there if you look for those opportunities. Chiropractic not included in TRICARE. It does have limited mental health coverage or health insurance, if you want to call that, through TRICARE, but not all of it. And I would say most MA plans that I have seen have more robust, coverage. So why would somebody get an MA only plan? For the same reasons that the others got the same an MA only plan. Again, I'm not going to debate whether they should or shouldn't here. We will maybe in a minute, but bottom line, it's money back in their pocket if they use no other benefit. And here you go. Here's a big hint. A whole bunch of people that have TRICARE have a 50% or above rating at the VA, and they only use the VA system. They don't even use their TRICARE. That's why. So maybe you don't want to necessarily enroll everybody in TRICARE, but I am telling you there is a substantial portion of TRICARE beneficiaries with a rating of 100%, and they will never go outside the VA system. Despite what I said, they will never go outside the VA system. They never use it, and they never will. Maybe they're the opposite of me, but they don't trust any civilian doctors. They don't trust anybody out. Let me rephrase that. They don't trust anybody outside the military. Okay. They will never go outside the military and the VA system. It's just never going to happen. So it has no effect on their health care. Like maybe we're opening some eyes out there a little bit. Dental, vision, hearing, they'll do it for that. They'll do it, because now they can go see a dentist. I have a client who's just like that. He retired in 1979, as an E8 in the Army. Long story short, this dude will never go see a civilian doctor. And I've done everything. He's a good friend of ours, family friend. I try to get this guy to go. He had cancer, testicular cancer. I mean, I had him set up with doctors, civilian doctors, the whole bit. He didn't care. He only goes to the VA. And the only reason why he has this MA only plan is because he has the Part B give back. And even though he gets free dental through the VA because he has 100% rating, he knows that part is a pain, and he'll go see a dentist in town. He absolutely loves me, and he probably sends me 30 or 40 people a year as a referral. I mean, all the time. It is crazy. And then we're not signing everybody up because we give them the whole information, but don't just discount that a person with TRICARE shouldn't have an MA only plan if you're a Medicare agent plan. Again, give the information, the whole truth and nothing but the truth, but give the information and let them decide. At least that's our shtick, right? You do what you want to do in your business. If you do, you better ensure that their doctors are in network, okay? Bottom line, don't put them on a drug plan. We see it all the time. People will call us with TRICARE and they're on an MAPD. Wrong answer. It's not very many scenarios I've seen that is put them on an MA only plan. Let them use TRICARE for their drug plan if you're going to do it. Major arguments against TRICARE, the same as before. Bottom line, you're taking somebody from literally the best health plan with unlimited access to pretty much whatever they want at no cost to them for the most part, and you're putting them into a limited system, a system with limits and all the things that go with the Medicare Advantage plan. So yeah, there's some negatives. I'm not arguing by any stretch that 100% of people on TRICARE should go in an MA only plan. I am not. We do not do that here in our office by any stretch. Some do, certainly not a lot, and certainly not all. Okay. Why? Because you're going to end up with things like carrier denials and approvals that come with Medicare Advantage plans, right? You are taking somebody from a no cost like Plan F with a PDP, and you're replacing with an Advantage plan and all the limitations that go with it. And that may or may not be the greatest thing for that client. All right. So think about the client and what they've done in their life and how they got this benefit, not just your pocketbook, right? You can still sell a dental, vision, hearing plan though. We've done a bazillion of those. So there's still money to be made if you're looking to make, commission, right? I'll tell you this, if you sell MA only plans to TRICARE and they don't use the VA only, so they're using civilian doctors, there's a high probability that you're going to get complaints from people that you sold that plan to. And if you talk to Humana and you without going into their spiel, I think they'll tell you that most of their complaints that they get within their system come from recipients that have, TRICARE and an MA only plan. I know that's the fact, actually. More than any other complaint they get, that's their number one complaint. So be careful about enrolling people in TRICARE in an MA only plan. I would say that's kind of unique to that particular company, by the way, and maybe not other companies, but there's that. Linda, what have you seen with TRICARE? I mean, have people who had TRICARE purchase from you and had success, and do you feel good about it?
Yeah, I do feel good about it. It's been a good fit for the people that I've helped, and the problems that they have had, we've been able to help them here in the office, such as billing issues and things like that.
Yeah.
Um, yeah.
Now, the other side, let's be fair. Have you had people that we've enrolled fairly? They knew what they were getting into in TRICARE, and then they later complained.
Yes,
Yep.
absolutely.
And so that's why I'm trying to put it out for, again, for everybody. Like, you make sure you know what you're doing, because this is where the complaints are going to come from. They're not going to come from Champ VA in our experience. They're definitely not going to come from the VA itself. You're going to get them from TRICARE. So be particular on who you're offering. I would say probably for TRICARE, the people that we talk to, it's maybe 50% will say yes, and the other 50% say no, and that's okay. And maybe that's even a little high. Maybe it's a little lower than 50% say yes. Again, our job that we do is we present the information, we let them make the decisions, but we do tell them the whole truth and what the whole scoop is. Even when we do that, sometimes they complain. So that's why, thank God, we have recorded calls. When, for us, when they started recording calls, we thought it was the greatest thing ever, because now we have proof that we said all these things. So for us, when Medicare did that, we're like, thank you, right? But where does the problem come from? Usually it's when they get a bill, because they're just not used to paying for anything like out of pocket. And they're like, what do you mean I got to pay? Even though you told them a bazillion times. And they'll have to submit that as a claim to TRICARE. There's a form they fill out, yada, yada, and so on. This is kind of something to consider. TRICARE's official policy is that they will cover, I think that's what I'm saying here. Yeah. TRICARE's official policy is they will cover the 20% of coinsurance that Medicare will not, right? So I'm going to tell you that some of these Medicare Advantage plans will have more than a 20% coinsurance, like 30% or 25%. Just look at the plans. Now, that doesn't mean TRICARE hasn't paid that bill, but I'm telling you, they reserve the right not to pay that bill. So be careful of the plan that you're selecting if it has a coinsurance above 20%. Because what if one day they don't, and then you're on the, now you look like, the jerk. Okay. You do not lose TRICARE like you would lose Plan F. All right. Somebody asked the question, if somebody was from TRICARE to an MA plan, can they move back? Yeah, they can move back. Right. Makes sense. Like, you don't lose TRICARE, dude. Like, you never have lost TRICARE. People say, I lost my TRICARE. No, it's not like you would lose TRICARE, I guess, if you didn't enroll in Part A and Part B, but they earn this benefit with blood many times. They are not going to lose it. Okay. It's not how that works. Like, it's not Medicare where you enroll in you're in Plan F or Plan G or N or whatever, and you go in MA only and you can't get back because you have a health ailment. Not like that at all. They can go on TRICARE anytime they want. They have to disenroll in the Advantage plan, and that may be a challenging, which is why they file a complaint against you if they don't like it. That's why you got to be careful when you're enrolling people in TRICARE. They really got to know. So if I'm enrolling somebody in TRICARE and I'm an agent and I don't want to have a CTM for Medicare and avoid that whole hassle with all the carriers and all that, I'm going to ask a bazillion questions to make sure, okay, do you know that you're going to have a copay that you're going to have to pay out of pocket? Right now you don't, but you're going to now. Yes. Okay, great. Do you know you're going to have to take that copay and send it in a form of a claim to TRICARE for them to pay it? Yes. Are you okay paying it? Can you afford it? Yada, yada, yada. So you really have to go through a bazillion questions, in my opinion, humble opinion, if you're going to sell TRICARE. Otherwise, you're going to get a lot of complaints for it. Okay. But again, don't discount selling to people who have TRICARE because you don't know their situation. I mean, I'm telling you, a large portion of retirees, especially those who serve for 20 plus years, right? Maybe not the ones who got wounded in combat, but the ones who serve for 20 plus years, like typically that would be me, but I don't fall in this category. They will not go to a civilian doctor if they don't give a rat's butt. In their life, they won't go anywhere. They'll drive the 8 hours in the middle of Oklahoma to go to that doctor. They won't go see anybody else. They literally be dying in the back of an ambulance, and they'll get out of that thing and kill the ambulance driver if they see anybody other than a military doctor. It's just not going to happen. It's just the way the world is, and that mentality. I used to think that way. I don't think that way anymore. Thank God. I'll go right down the street, right? But they will not. I know so many dudes that are like this. So trust me, they're all over. So those people, not a bad fit oftentimes for TRICARE. Okay. Yeah, somebody put they're losing their TRICARE for life. They're getting an MA only plan on top of their TRICARE for life. They don't lose TRICARE, right? You don't lose it, right? You're getting your primary insurance company becomes the Medicare Advantage, but you don't lose TRICARE. You can get rid of your Medicare Advantage plan and go right back on TRICARE. So that is a thing. Bottom line, educate the veteran, make sure they know what the choice is and let them make the choice. Some are going to do it, some will not. Okay. Maybe 50-50, maybe 30-40% will, and maybe the rest won't. Medicaid, you're going to get a lot of veterans on Medicaid. Now, oh yeah, all right, in every category of everything I've talked about previously, meaning there's a lot of veterans that are on TRICARE that have Medicaid in their full duals, or they're at the VA in their full duals. Remember, 50%, I've told you, 50% of the 9 million, well, there's more than 9 million, but 50% of veterans in the United States under 65 are on Medicaid. That's a crappy statistic for our veterans, but that's just the facts. Okay. So as they age in, you can expect a large portion of the people you're talking to have some form of Medicaid, maybe not full Medicaid, but they have an LIS. Hopefully, you know what that is at this point. So, if they're on Medicaid and they qualify, I absolutely would ask them if they have Medicaid every single time, because a large portion of them do, and do a dual check. Well, you can enroll them into a dual plan, just like any other dually. Now they're going to get a lot more robust benefits, and they really like you then, because now they think they're going to have to pay when they go out in town, and they don't want to do that. Well, you can get them nice world-class coverage hopefully you know that, with a civilian doctor outside the VA system, with all the choices that go with it, with a great doctor in a full dual plan oftentimes, with your favorite dual plan, right? There are so many veterans that have that go to the VA that have no idea that this is available to them, and all the massive benefits that are available in a typical dual plan, right? Like the benefits that can really help them. Like, I don't know where this is all going to be. I don't want to say all the things that are in an Advantage plan, CMS is watching, but like they can eat, right? So, or they can get rides. I mean, man, I can't tell you. So depending on this current status of the healthcare, put them in a dual plan could hurt them for putting them on, I'm trying to say, put a co-pays if they have Champ VA or TRICARE. Yeah, you got to be careful if they're on Medicaid and TRICARE or Champ VA. That could possibly hurt them. I haven't had it happen, but I've heard of it. I haven't had it happen, but I've heard of it. Sometimes an MAPD is only the answer if you do it. I don't know if I would do it if they have Champ VA or TRICARE for that, but I'm just trying to give you the whole scoop here. Because it's Medicaid, what I'm trying to say down here is if you have somebody on Medicaid and they have Champ VA or TRICARE and you put them on an MA only, the carrier is going to come back and then force them into an MAPD most of the time. And then you have to work with the carrier and tell them why they need an MA only plan. And it's kind of a pain in the butt. So you got to be careful with these kind of people. There's a large chunk of people in TRICARE that are on Medicaid. You'd be surprised. Okay. It's kind of difficult to deal with that situation because you don't really want to put them on a PDP. So you got to be careful, really, really careful with these people. So if you're talking to a veteran, ask them if they have Medicaid or ever have Medicaid and all that. So I hope you understand where I'm going here. I don't want to belabor this point because probably could talk for 20 minutes on this right here. It's kind of difficult. SEPs. The bottom line, I'm not going to go down the whole SEP thing. Hopefully you're a professional agent, you know all the SEPs, but I really could go down this whole thing. So the big one is going to be blah, 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 blah. This one right here, OCC. Some carriers will call it MCC because I don't know why they do. Most will call it OCC. So it is a SEP year-round that is available officially. I will say not every carrier honors it in the same way that at least one carrier honors it. And that has changed in the last 3 to 5 years for sure. If I had to guess, it probably comes down to quarterly profits for the carriers, but who knows? What is the SEP officially? It's original Medicare to MA only. That's, the SEP. PDP to an MA only, you can use that, OCC or other creditable coverage. Or MAPD to MA only, that's when you can use it. So the bottom line, they can go from original Medicare to MA only. You can use it for that. You can go from a PDP to MA only, or you can go MAPD to MA only. Where you're probably going to have a problem is that first bullet point, which is original Medicare to MA only. Okay. If you're going to get denied, that's where it's going to happen. We've had it denied a small percentage of the time when we've wrote it with a certain carrier. Most carriers will deny it every time. Humana will not, if you want to know that. They will sometimes deny it, but not all the times deny it. If they've denied it, we just will resubmit it, and they'll typically approve it, whatever reason. The other carriers will typically approve a PDP to an MA only, an MAPD to an MA only, right, with the OCC step. All right, so there you go. That's a little feather in your cap to make money from, what is it, April 1 to September 30th, okay? Do not do OCC for the following: MA only to MA only. Not happening, going to get denied. I don't know why I didn't put 100% of the time. It's going to get denied. Don't use it for, the LIS. If you use other steps in lieu, like OCC should be the last step available if you have other steps available in front of it. So if you have an LIS step, use LIS if it's available. If you have IEP, use it. If you have AEP, use it. All the other ones that are available, use all the other steps available. OCC, when you're dealing with veterans, should be your last step, okay? Because carriers don't like using it, and Medicare doesn't really like to use it. Yes, I haven't heard of OCC or MCC. I'll take $5 every time you sell a policy using OCC or MCC. We have written, whoever put that, we have written, I don't know, at least 4,000 OCC policies. Just, don't abuse it, folks, or you're going to lose it. All right. Don't abuse it or you're going to lose it as a Medicare agent. It's PDP to MA only. Officially, get rid of the first bullet point. It's PDP to MA only or PD to MA only. All right. It's to MA only. That's why MA only is the play for the most part for many veterans. MAPD to MAPD, it will get denied. Okay. So if you want to put somebody on MAPD and they're a veteran and it's, June, very difficult unless they have an LIS or some other SEP. Okay. So a lot of times if you want to do that, so they have the option to buy outside of town. If you don't have a SEP, well, maybe you put them on LIS now and then later on during AEP, you switch them over to an MAPD because that's what you wanted to do. I don't know. We've done that a few times, but hard to do. You can't necessarily just put somebody on an MAPD with an OCC SEP. It's MA only. So they have a drug plan. They do not need it because they have creditable coverage somewhere else, and you can put them on an MA only. So if somebody has a creditable coverage, that's what OCC stands for, other creditable coverage. You can put them on an MA only plan, okay? Like the VA system, if they're 50% or above, they have creditable coverage. MAPD, MAPD, it's going to get denied. Find yourself another SEP. We like to tell our agents you need to be a SEP hunter from April 1 through September 30th. So you better know your SEPs. If you're selling Medicare and you want to be a serious full-time agent, you better study, know, and learn your SEPs like it's the back of your hand, ready to go, right? Like we have an agent, he literally asks everybody if they just got out of prison because he gets answers. He gets yeses every now and again on his SEPs. So I have some questions for you. The lead has so you're talking to a lead, a veteran. The lead has original Medicare. Doctors and drugs are at the VA. What plan do you put them on? Well, I guess it depends on the time of the year, but you can put them on using the OCC SEP, an MA only plan, let's say in June or July, right? If it's any other time of the year, you can also put them on an MAPD if you want to. The lead has a PDP with doctors and drugs at the VA. So doctors and drugs at the VA. What plan do you put them on? Well, if they have a PDP, that assumes they have Medicare, right? You can use the OCC SEP and you can put them on an MA only plan, right? AEP, maybe you want to put them on an MAPD. The lead has an MAPD with doctors and drugs at the VA. What do you do there? You can put them on an MA only plan using the OCC SEP. The lead has full Medicaid with doctors and drugs at the VA. Well, you can put them on a full dual plan. Okay. Again, if they have Champ VA or TRICARE, be careful. Okay. Because you might hurt some things there. But the bottom line, you put them on a full dual, and what a deal they get, right? The lead has original Medicare, civilian doctors and drugs with TRICARE. What plan do you put them on? The most you would want to put them on is an MA only plan. You do not want to put them on MAPD. Why? Because they have their drugs with TRICARE. Okay. So TRICARE equals MA only if you do it at all. The other thing you could sell potentially, if that doesn't work out, is a dental, vision, hearing plan. The lead has original Medicare with civilians and doctors with CHAMP VA. CHAMP VA equals MA only plan in your brain. Okay. These are all these scenarios that I'm talking about as a professional. You got to know the answer like that at the, at a whim, and you got to know exactly what to do and exactly how to say it so that you're professional, because the other 20 agents that are calling are not going to be professional. They have no idea what they're doing. And the veterans know. They can smell it. Okay. Elite has PDP with civilian doctors and drugs at CHAMP VA. Civilian doctors, all right, meaning they have a drug plan probably out in town. Now you're looking at an MAPD, and you're not going to get a SEP if it's during the SEP, period. Elite has an MAPD with civilian doctors. It's already telling you right there that with CHAMP VA in both of those. So you're going now maybe the wrong. I didn't see that before on question 7 with CHAMP VA. You're looking at MA only with CHAMP VA because the PDP is, they're using CHAMP VA as their drug plan. So probably an MA only with CHAMP VA, I guess. Maybe I made a trick question there for myself. I'm not sure why I did that. They have an MAPD, civilian doctors and drugs, but it has CHAMP VA. CHAMP VA, they do. Some CHAMP VA people don't use CHAMP VA drugs for some unknown reason. Again, you can educate them about the system. They don't even know. And when you tell them, they're going to be thankful. But a lot of times you will put them on an MAPD because they don't care. They don't even want to do it. There's a small percentage of people that CHAMP VA, I don't want to go into what's going on there mentally, but they don't want anything to do with it, right? This is too painful for them to deal with the loss of somebody that died, that gave them the CHAMP VA. They don't want to deal with it. They just want, like everybody else, they don't want to be reminded of it. So they want to get rid of CHAMP VA. It's kind of a weird thing, but that's what that's talking about. They have an MAPD with civilian doctors and drugs. The VA, what plan do you put them on? Civilian doctors. That tells you there's something going on, but their drugs are at the VA. MA only, pretty good option for that one, right? PDP with doctors and drugs at VA, but wants doctors outside the VA system. What plan do you put them on? You could do MAPD if you wanted to, or you can do an MA only, probably an MA only. They have a med sup with civilian doctors and drugs at the VA. I don't know. That's the whole argument if you want to take somebody off the SUP and put them on an MA only or not. But either way, they have the drugs to the VA. That's probably an MA only if you do it. Or maybe another SUP, right? We've written many other SUPs. There's definitely a small contingent of veterans that go to the VA with a SUP, and we just put them in another SUP if they're healthy enough. Lead has TRICARE, gets all drugs through the VA. And, doctors, that's that scenario where, yeah, maybe an MA only is a pretty good match for that person. That's who I was talking about earlier. Lead gets CHAMP VA, gets all drugs and doctors through the VA. Okay. What's wrong with question 14? Anybody? Linda, let's see if you know this one. Putting you on the spot.
Lead has CHAMP VA, gets all their drugs through the VA.
What is wrong with this question? I will give $50 to any agent who can instantly ask this question. You have 10 seconds in the chat. 9, 8, 7, 6, 5, 4.
You should be getting
3,
his medications free through CHAMP VA.
2, 1. Wrong answer. If you have CHAMP VA and you have Medicare, you cannot go to the VA. That is correct. Whoever said that after the 10 seconds was up, I don't owe you $50. You cannot go to the VA if you're on Medicare and you have CHAMP VA. That's why I put what's wrong with this question. Okay. So lead has CHAMP VA, gets all in drugs and doctors through the VA. What's wrong with this? They can't do that. Okay. The lead has TRICARE, CHAMP VA. What will they have out-of-pocket costs with MA only plan? Yes, they're going to, but they should get potentially. Depends on how the doctor's office bills them. Okay. The lead has a VA. I don't know where I read all these. Almost know all these questions. Lead has a VA and gets drugs to the VA. Wants to go to the doctor's office outside the VA. So you put the lead on MA only plan. Will that lead have out-of-pocket expenses? Yeah. If we've heard any complaints from somebody who goes to the VA, this would be it, because they're used to paying nothing. Then they go to the civilian doctor, and then they'll have some sort of out-of-pocket expense on an MA only plan. You make sure they know that when they go out in the civilian world, to a regular doctor out in town, like any MA only plan, they're going to have co-pays and co-insurance if they use it. Again, this is like your last resort. If you want to get outside the VA system, you can use it. You're going to get all these benefits. But again, you're going to have some costs and co-shares and yada, yada, yada per the summary of benefits. Okay. but they're still happy to get it. Just make sure they know about it. You set up a lead with MA only plan. Lead also has TRICARE, Champ VA. What's the major issue of this? Again, we've talked about this. Bottom line, you're taking somebody from probably the single best healthcare plans that are available with TRICARE and Champ VA, and you're taking it away, all the networks and all the things, and putting them on like the networks and the things that go with being on a Medicare Advantage plan. And maybe that's a big no-no. Depends on you and how you want to run your business. I have a question for you. Are there any issues with putting somebody on an MA only plan if they have Veterans Without Hair Fares only for their healthcare? If they only go to the VA and they're below or above 50%, is there any issues with putting them on a MA only plan? No. There are no. We have not had any issues putting people on an MA only plan, especially the ones that are 50% or above. If they're below 50%, we will tend to put them on an MAPD so that they can get drugs in town if they want to. Does Champ VA include dental, vision, and hearing, mental health care, and chiropractic? Linda, what do you got?
No, they don't include mental health care and chiropractic.
You got $50. All right, you're good. You're right. Linda, $50 winner for the day. Does TRICARE include dental, vision, and hearing, and chiropractic? No, it does not. And that is the end of the presentation. If you have any questions, throw them in the chat. Otherwise, we are done for the day. I do appreciate you. I feel like I went 31 minutes too long, but hopefully this helps you. And if you have any questions, feel free to chat with me on the old Facebook. Please understand that I may not respond in a timely manner because I do have things I have to do myself, but I will try and get to you at some point. If you have any questions, feel free to ask or ask in the group or whatever. We've been a little busy here, so I apologize for not participating as much as we should have in the old Facebook group, but it is what it is. We're pretty busy. So lots going on. So hopefully I've helped some people. If you have any questions, feel free to chime in and be more than happy to answer any questions that you have or any comments or whatever. So thank you. Appreciate you. You can log off whenever you want, stay on, whatever, but I'm about to cut this off pretty quick. What was that? Is TRICARE and TRICARE for Life treated the same? No, they are not. They are basically two different things. So how does that work? TRICARE is the easy way to do that is if you're not on Medicare and age 65, you're on TRICARE. And when you and you're retired, when you turn 65, it suddenly becomes TRICARE for Life. And there are differences. So TRICARE has networks, kind of like an MA only, kind of like a Medicare Advantage plan. And like most plans under age 65, I have networks and places I can go and can't go. I have co-pays and out-of-pocket expenses and yada, yada, yada. And you may have premiums depending on the status of how the person got it. Like maybe they were reservist and they're paying a monthly premium for it, but they retired a reservist or whatever, or whatever. So there's different premiums for the plan, just like any healthcare plan under age 65. And there's networks and all the limitations that go with it, like referrals and all that. When they turn 65, totally changes. It becomes just like a supplement, kind of like Plan F with a Medicare, with a prescription drug plan, and very low to no healthcare costs. It's the best deal since sliced bread. And so there is a difference between TRICARE and TRICARE for Life. Great question. Both need dental, though, if you want to sell them a dental vision hearing plan under 65 or over 65, and maybe some other things. Should somebody with TRICARE get a cancer plan? Yeah, why not? So anyway, hopefully that helps everybody. If you have any more questions, just send them in the old Facebook. I'll be more than happy to answer your question. Have a great day.